Welcome to the Clean Classrooms for Carolina Kids Asbestos Section Training. This program is a partnership between RTI International and the North Carolina Department of Health and Human Services, along with the North Carolina Department of Public Instruction as a liaison. To begin, the overall goal of this section of the program is to identify and eliminate exposure to asbestos hazards at public schools and child care facilities. For facilities that require an inspection, we will coordinate an on-site visit by an accredited asbestos professional. If hazards are identified, facilities can request reimbursement from NCDHHS if they decide to perform mitigation activities. We encourage you to also be communicating with your community regarding your progress through the program. We provide communication resources on our website that make it easy to update staff, parents, caregivers, and students on the program. We're going to quickly overview the lead-based paint section steps. The first step is attending the pre-enrollment webinar to learn about the Clean Classrooms for Carolina Kids program. And this step is completed. Following this training video, the primary contact will be ready to complete the enrollment survey and upload necessary documents. Our team will review the enrollment survey responses to determine next steps for your facility. If we determine that a lead-based paint on-site visit is needed, our program will then assign a certified lead risk assessor for your facility. The certified lead risk assessor will schedule the on-site visit with your facility and will then conduct their on-site visit, including sampling if needed. Any samples collected will be analyzed at our laboratory. Once results and recommended next steps are available, you will be notified by email that they are ready for your review. Facility administration should notify parents, staff, and students of the results using resources provided by our program. If any lead-based paint hazards are identified, the facility must restrict access to those areas or choose to mitigate based on the recommended response actions provided by the certified lead risk assessor. If any mitigation activities are conducted, facilities can request reimbursement from NCDHHS. Now let's talk more about the who, what, why, when, where, and how of the lead-based paint section of the program. Your facility should designate a primary contact to complete the survey and be the main point of contact for the lead-based paint section of the program. Additional individuals can help to complete the enrollment survey if needed. In order to access the enrollment survey, you must complete this training. So who should be the primary contact? The primary contact should be familiar with any lead-based paint assessments that have already been conducted at your facility. They should be familiar with the layout of all buildings at the facility. And additionally, if lead-based paint hazards are identified in your facility, the primary contact should be able to oversee the efforts to restrict access to or mitigate those hazards. To complete the lead-based paint section enrollment survey, the primary contact will need information on your facility, such as when it was built, student demographics, previous assessment details, any concerns about exposure, past and planned building renovations, and exemption documentation, if applicable. Exemption documentation must be submitted to RTI for a facility to be eligible for an exemption from an on-site assessment. Facilities that were built after 1978 may be exempt if the child care facility operator or operator's designee can sign an attestation that no lead-based paint was used in the buildings. Facilities may also be exempt if they provide documentation of a lead risk assessment conducted within the past 3 years. Additional documentation may be requested to verify that the prior assessment meets the rule requirements and any identified hazards have been addressed. It is important that documentation is submitted to the program because this is a state-mandated effort to digitize lead and asbestos records and make them easily accessible in a public document repository. If your facility is not exempt, an on-site visit will be required. You will be notified when a certified lead risk assessor is assigned to your facility. The lead risk assessor will contact your facility soon after being assigned to schedule the visit at a day and time that works for everyone. We estimate that the on-site visit is expected to last 1 to 3 days, depending on facility size. During the on-site visit, the certified lead risk assessor may assess the interior and exterior of your buildings for lead-based paint hazards, including paint, dust, and soil. The lead risk assessor will likely use a portable XRF instrument to identify lead concentrations in real time and also collect samples as needed. In general, lead sampling is non-destructive, but may cause minor damage to sampled materials. To prepare for the on-site visit, the primary contact should plan to meet the certified lead risk assessor when they arrive to give them access to the facility. Floor plans should also be available for the risk assessor to review while on-site. And finally, your facility can remain open during the on-site visit, but local areas may need to be restricted at the discretion of the risk assessor. Thank you for helping us identify and eliminate lead and asbestos hazards where North Carolina children learn and play. You may now continue to the LeadBased Paint Enrollment Survey to complete the questions and upload any applicable documentation. If you have any questions, please contact our team using the QR code or website link on the slide. You can also call or text us at 1-855-997-2864 or visit our FAQs page. The Clean Classrooms for Carolina Kids team is here to help you throughout this entire program. Thank you.